The Marshall Products Laryngeal Airway Device, or LAD, is a latex-free oral airway device consisting of a large-bore tube with an elliptical inflatable cuff. The cuff is operated using an inflation-deflation valve, which is attached to a pilot tube. A pilot balloon allows the pressure within the cuff to be assessed. The wide-bore tube has a 15mm connector at the opposite end to the cuff. The tube is clearly labelled with the LAD size, the weight of patient for which the LAD is recommended, and the maximum volume of air that can be inserted into the cuff. The LAD must only be used by or under the instruction of a qualified medical practitioner. Since the LAD should be considered to offer no protection against aspiration of regurgitated stomach contents, patients must be selected carefully. The LAD should not be routinely used in patients who have an increased risk of regurgitation or aspiration. An exception may need to be made, however, when the LAD is used as a rescue device during resuscitation. There should be a clearly marked syringe prepared for inflation and deflation of the LAD cuff, and a bite block, water-soluble lubricant, and cuff pressure monitor should be available. The appropriate size of LAD must be selected based on the patient weight, and gloves should be worn when handling the LAD. Before using the LAD, a series of checks must be carried out. The wide-bore tube must be examined for blockages, cuts, indentations, discoloration, loose particles, and foreign bodies. Should any of these factors be detected, the LAD must not be used. Each end of the wide-bore tube must be held and the curvature increased up to 180 degrees to ensure the airway tube does not kink. The cuff should be fully deflated, and there should be no leakage of air into the cuff. Reinflation indicates a puncture in the cuff or failure of the inflation-deflation valve. The cuff should be reinflated with a volume of air 50% greater than the maximum inflation value allowed for each size. There must be no leakage out of the cuff, and the cuff must not herniate. The pre-use tests are designed to ensure the LAD is safe to use. A device that passes all the tests is ready to insert. Use the index and middle fingers to push the LAD cuff onto a clean, flat surface and remove all the air with a syringe. This creates the stiff, thin leading edge necessary to insert the LAD. Lubricate the back of the cuff just before inserting the LAD. Do not apply lubricant to the front of the cuff, as this may result in aspiration of lubricant. Anesthesia must be deep enough to permit insertion without patient resistance. As a guide, the patient's jaw should be relaxed, and jaw thrust will not cause the patient to move. One hand should be used to ensure the neck is flexed and the head is extended. If desired, an assistant may aid insertion of the LAD by opening the mouth prior to insertion and applying jaw thrust during insertion. With the other hand, hold the LAD like a pen, placing the index finger at the junction of the cuff and the tube. Stroke the LAD against the palate to distribute the lubricant, and then press the tip against the hard palate, ensuring it lies flat and that the tip does not fold over. Using the index finger, push the LAD backwards, maintaining pressure against the palate and avoiding collision with the tongue. As the cuff moves downwards, the index finger maintains pressure backwards against the posterior pharyngeal wall to avoid collision with the epiglottis. The flexor surface of the whole index finger should be along the tube, keeping firmly in contact with the palate. The LAD is inserted in a single smooth movement, following the curve in the palate. The route the LAD takes through the mouth and pharynx mirrors the route taken by a bolus of food during swallowing. Resistance is felt when the tip of the LAD reaches the lower limit of the pharynx. The index finger should then be withdrawn from the mouth, whilst the other hand holds the tube and gently presses down to ensure the LAD remains correctly in position. For those with small hands, their index finger may be too short to fully insert the LAD and encounter resistance. In this case, the advancing finger should remain in place, while the hand maintaining the head position can be used to advance the LAD until resistance is encountered. When correctly inserted, the black line on the LAD tube should face the upper lip, and the device should lie in the midline. Now in position, care should be taken to avoid moving the LAD up and down in the pharynx. Use the syringe to inflate the cuff with sufficient air to obtain a low-pressure seal. Half the recommended maximum volume of air is frequently adequate. To ensure the LAD positions itself correctly, do not hold the tube during inflation. Use a cuff pressure monitor to ensure the cuff is inflated to a pressure not exceeding 60 centimeters of water, and check the pilot balloon as inflated to an oval shape. During inflation, the anterior neck may bulge slightly and the LAD may rise out of the airway slightly, but it should not rotate. When correctly positioned, the epiglottis rests over the top of the LAD cuff, and an effective seal is formed with the pharynx. The LAD cuff sits around the laryngeal opening, allowing gases to and from the lungs during ventilation. The tip of the LAD sits against the upper esophageal sphincter, helping to prevent leakage of gases into the stomach. Gently inflate the lungs using a Marshall manual resuscitator, holding the tube to prevent displacement. Listen over the chest during inflation and observe bilateral chest movement to confirm air is moving into and out of the lungs. Insert a bite block and tape or tie the LAD into place, ensuring the proximal end of the airway tube is pointing caudally. The bite block used can consist of rolled-up gauze swabs, or an oropharyngeal may be used. A correctly placed LAD airway tube will press back into the palate and the posterior pharyngeal wall. Since the LAD is permeable to a number of gases, the pressure in the LAD cuff may increase over time. The cuff pressure should therefore be checked at intervals throughout the procedure to ensure the pressure does not exceed 60 centimeters of water. Air can be withdrawn from the cuff using the syringe when necessary. The shape of the pilot balloon should be monitored to ensure it remains inflated. The LAD should be removed in an environment where oxygen, suction, and appropriately skilled staff are available. Suction down the lumen of the LAD is not routinely necessary because the LAD will protect the larynx from oral secretions. The LAD should only be removed once protective reflexes have fully returned and the patient can open their mouth on command. The onset of swallowing indicates that reflexes have almost been restored. Before removing the LAD, the cuff must be deflated either completely or partially. Removal with the cuff partially deflated can assist the removal of secretions. The LAD can now be gently removed from the mouth. Marshall Products is a leading supplier of laryngeal airway devices. The Marshall LAD has been used in over 2.5 million procedures. For further information about the LAD range, please visit the Marshall Products Limited website on www.marshallproducts.co.uk.